Hello.
Yes, sir.
No voice, ma'am.
Good morning to all the participants. Sir will be joining shortly. We will start our session within a minute. So please stay with us. Malik sir. Malik sir, please unmute yourself.
Yes, madam. Good morning, madam.
Good morning, sir. Good morning, sir. How are you, sir?
Fine, madam. Thank you, madam.
Sir, shall we start? Malik sir, shall we start?
Yes, madam. Is it audible, my voice?
Yes, sir. Sir, please raise your voice little bit more. Voice is needed. And so you are co-host now. You can also share your slides. Melissa, shall we start now? Malik sir?
Yes, madam.
Sir, shall we start?
Yes, madam.
Okay. Welcome and good morning to all the participants and our today's resource person, Dr. Arunabha Mallik sir, on day 4 AICTE sponsored short-term training program on interplay between health, well-being, environment, and community pharmacy. Before starting our today's session, I would like to introduce amongst you all Dr. Arunabha Mallik sir. He is presently working as a professor and in charge principal at MLR Institute of Pharmacy in Hyderabad. Sir has an experience of more than 12 years in teaching and research. Sir has completed his BPharm and MPharm from Rajiv Gandhi University of Health Sciences, Bangalore. Sir has been awarded PhD in Pharmaceutical Science from JNTU Hyderabad under the guidance of Dr. Satish Naik. Sir has been felicitated with Award of Excellence and the Best Presenter Award in the International Conference in Malaysia. Sir has more than 30 publications in his name in various national and international journals and authored a textbook entitled Animal Handling Techniques and Protocol Development Studies. He is also a member of editorial board in various national and international journals. He has also been a resource person for various seminars, workshops, and faculty development programs. Sir is an active member of different professional bodies also, such as ICTE, API, etc. So now, with these words, I would like to welcome you, sir, on the behalf of SIRT Pharmacy and Stage Group in this AICTE sponsored short-term training program.
Thank you, madam.
Shall I start, madam?
Yes, sir. Yes. Please, sir.
Okay. Thank you. Thank you, Priyanka, madam, for giving my introductions and for inviting me. And I would like to thanks to this group, Sagar Institution of Research and Technology, that and engineer Sanjeev Agrawal sir, CMD Stage Group, and Executive Director Madam, that is the Shivani Agrawal Madam. And I also thankful to Dr. Suranjan sir, Director SIRTP, and Mrs. Priyanka Rathore Madam, Coordinator of this program, and all the organizing members of this program. And I never forgot to thanks that AICTE. They are giving us such type of the opportunity to conducting different type of workshops and seminars and that short-term programs. So absolutely, I also thanks to AICTE, and mostly that and that is the very important. I want to thanks all the participants because people are here for your love and affections. I'm here, and now I want to start my presentation. Okay, so shall I start, madam?
Yes, sir. Yes.
Once you confirm me, my screen is visible
Yes, sir. Visible.
and the sound is okay.
Yes, sir.
Audio is okay.
Yes, sir. Perfectly.
Okay. Okay. Thank you, madam. Thank you. So, as we know that multi-drug resistance or antimicrobial resistance, that is one of the biggest problem in the world. Okay, so that because of that biggest problem in the world, so that how will manage this type of the multi-drug resistance to the patient and to the community and to the global wise. So as a pharmacist, as a community pharmacist, we have the different type of the roles and we have a different type of the functions to that manage or to decrease the antimicrobial resistance activity. For that reason, I have choose this type of the topic that what are the, as a pharmacist, we have the several type of the role. So as a community pharmacist, what are the different type of the roles are there or functions are there to fight against in the antimicrobial resistance. So before going this topic, so I'll briefly tell about what are the different objectives today's topic. So why and what are the different type of the objectives are there, and what are the main points today's discussion is that I'll try to complete all the things within the given time or within the limited time. So, and before that, the objectives of today's discussion is that is the what is the microbial resistance, and what are the global scenario, what are the problems are facing by throughout the global, not only India, Asia and Europe and other countries also, and why antimicrobial resistance are a big concern, what are the problems and why we should take care or we have to manage this type of the problems in our society, and how antibacterial drugs are working, what are the basic mechanism antibacterial drug, and what are the different type of the resistance mechanism, how the bacteria or any type of the organism they are getting the resist and they are not working if you will given the different type of the antibiotics also, and what are the different type of the factors which are responsible the antimicrobial resistance, and after that what are the different type of remedies are there to treat or sorry to manage this type of the antimicrobial resistance, and lastly and most important, that is the what are as a pharmacist what are our role to manage the antimicrobial resistance. So these are the topics today I want to discuss in front of you. I'll try to that communicate this type of the problems and throughout the global, and what are the different mechanisms and what are the factors and how we can overcome this type of the antimicrobial resistance, what is our role. So coming to the first slide, the introductions. So in that introduction, microbe and antimicrobial have a greatly contributed to the decline, the morbidity and mortality in infectious disease. As we see in our previous history, so we can see in different type of the diseases, like also one pandemic situations also now on, that is the COVID-19. But even though in previously simple, what now we are thinking that diarrhea, dysentery, cholera, that is a very simple disease. But if you will back to the history of global wise, we can see that different type of the diseases that can damaged lots of people or died lots of people, and that mortality rate also decreases. But when the antimicrobial agents came into the society by the different type of the scientists, great scientists are there, was there, when they discovered different type of the microbial agents. So after that, so it is a very important and very useful medicines for treat the infectious disease. But about that achievements are there, no doubt. But in that achievement, some destabilizations also there. Destabilization is that rapidly that growing the problem of AMR, antimicrobial resistance. So because of that, we are again going to the previous era, that pre-antimicrobial era. It may be chance if we will not manage this type of the thing, antimicrobial resistance, if we will not manage, so there may be chance we will go again that previous pre-microbial era. For that reasons, the community pharmacist has a powerful mechanism to improve the microbial management to control the AMR. So basically, we'll talk about here what is the microbial and what are the microbial resistance. So as we know, antimicrobial, that antimicrobials, that are the drug or that are the chemical agent, that are the substance which can be used for treatment or for including the antibiotics, antiviral, antifungal, and antiparasites. That are the medicines that used to prevent the different type of the infectious disease or treat the infections, and not only human beings, that can be used to treat the human beings and animals and even the plants also we are using. So what is antimicrobial resistance? So antimicrobial resistance is not that's occur when the bacteria, virus and fungi or parasite change over the time and that no longer responds to the medicines. Okay, there are the several type reasons are there. There are different what it is called, different mechanisms are there. Later we'll discuss about this mechanism. But basically what happened, they are not responding. Okay, because that making the infectious harder and treat the increasing the risks of disease spread and severe illness and death. As a result, we can see the drug resistance, antibiotic and other antimicrobial medicines become ineffective, and infectious become increasingly difficult to possible to treat. So that are the basic things. But if we will see the global scenario, what happened in that and what occurred because of that antimicrobial resistance. If we look on the global scenario, we can know that different type of the pathogen causing organisms are there, like tuberculosis organism, malaria, sexual transmitted infections, typhoid, bacterial dysentery, pneumonia. So several type of the disease causative organism, they are now resistance of multi drugs. We can observe that first generation, second generation, third generation drug, and even the fifth generation's drug are also there. So continuously we are changing the generation. Continuously our scientists are working on that. Because why? Because mainly the important diseases or mainly the common diseases, they are this type of the organism they are getting, they are already their resistance of the different multi-drug resistance. Even though we will focus on the tuberculosis, 17% tuberculosis, they are multi-drug resistance tuberculosis. So, so in that tuberculosis, so in here, not only multi-drug resistance, that also extensively drug resistant XDR also. Okay, so that tuberculosis now being recorded in the countries worldwide. And if we'll focus on the malaria disease, so we can see that 81 out of 92 malaria different countries. When we'll talk about the 92 malaria country, that chloroquine such no longer effective. Previously, chloroquine is a very important drug and for the treatment of the malaria. But now we can see that the chloroquine itself, it is not working on the malaria treatment because they are getting the drug resistance. The organisms are got the resistance of the chloroquine. So for that, we are giving the several type of the drugs or combinations drug to treat the malaria. Not only that, if we will see about the other disease, other organism, like we can talk about the Salmonella typhi, that is a common organism for typhoid disorder. So that also got the multi-drug resistance in the Asian country, most of the Asian country. And if we talk about the Shigella, so here also that are resistance of ampicillin, tetracycline, clotrimazole, and chloramphenicol, that are the most important and common antibiotics we are using widespread of African country that are got the resistance of about this type of the drug by this type of the organism. About 90% resistance of ampicillin and clotrimazole has been found in the part of the Asia. And resistant emerging of the fluoroquinones now only choice of the drug to treatment of this type of the organism or to treatment of this type of the infections. Again, if we will focus on the Streptococcus pneumonia, here also we can see that penicillin and erythromycin, they got the resistance in the pneumonial disease. Brazil, Kenya, and Uganda. So that are the country there the Staphylococcus pneumonia got resistance. So if commonly we can say or two other class of the drug, if we will talk, so here we can observe that different type or different country getting that Africa 15%, sorry 25%, and that Middle East 18%, Latin America, throughout the world we are facing same type of the problem. So that's why it is a global issue, that multi-drug resistant. So that's why we have to focus on that multi-drug resistant, and as a pharmacist we have the several type of the role to treat, to manage this type of the multi-drug resistance. Sometimes what happens, that is the MR in the hospitals.
Malik sir, Malik sir, sir please unmute yourself.
Is it visible now, madam?
Yes sir, now it's visible.
Hello.
Yes sir, now it's visible.
Okay. So
Visible sir.
so if we'll think about the hospital, so that 10% of admitted patients that are getting the multi-drug resistance, by the different patients, and that communicate by the different, and that community spreading are also there. The hospital is the important source of the medicine resistance infections also. So different type of the organisms like that Enterococcus falicum and Enterococcus E. coli, pneumonia, several type of the organisms can that communicate from one patient to another patient. So another important point is that is the nosocomial infections and AMR. So nosocomial infections is nothing but what we discuss in the hospital communication, hospital contaminations or hospital that what it is called disease, communicated disease, which is occurred in the different organism by including pneumococcus, mycobacterium tuberculosis, and salmonella. Hospitals acquired infections is among the most prevalent cause of death and developing world. And horizontal transfer of resistant genes from one strain to another strain can also instantify the possibility of resistant nosocomial infections. So still now we have seen that several type several type of the global issues we observed. Now when we'll talk about the why the antimicrobial resistance is a global concern. So if we'll talk about that, there are the several type of the reasons are there, like resistance of organism leads to treatment failure, one of the most important, because when we'll give the drug, the already microorganism are resist about that organism antibiotics, so that antibiotics cannot work properly. Okay, so one of that treatment failure, increase the mortality rate. If treatment failure, obviously the mortality rate will be increases. If the resistance of bacteria are occur in our human body, it may be spread to the community by the hospital communication, by the different community communications also it can be spreaded to the community. And a low level of resistance can go undetected. So if the resistance is less, so we can't detect this type of the resistance to the bacteria. By it is difficult, quite difficult, or quite challenging to the microbiologist to detect the resistance. And added the burden of the healthcare cost, because of course, so when we are talking about the next generations of antibiotic, so and this time of that that will be increases the cost of the treatment. And because the patients will be long time that will stay in the hospitals, and there may be chance to that increasing the high quality or another generations of the antibiotic. So the cost will be effective on the treatment and make threats to the return to the pre-antibiotic era. Already I said that maybe if we will not manage that properly, there may be one of the threats are there, one challenge are there, that maybe comes to the pre-antibiotic era again. So for that reasons, that are the antimicrobial resistance is one of the global concern. So if we to take the examples of impact of the AMR, examples of multi-drug resistant tuberculosis. So if we'll see that increase the morbidity and mortality. So if we'll talk about the multi-drug resistance occur by different type of the drugs which are used to treat the tuberculosis, we can see that for the treatment that is the 300 times more expensive. So it will be increased the 300 times more expensive when we're talking about the standard treatment. So as we'll compare the standard treatment, it's maybe taken $20 US, but when any patients is suffering multi-drug resistance, so it may be reached to the $6,000. So it is approximately 300 times more expensive treatment for the treating this multi-drug resistant tuberculosis. So, and another one is that the treatment duration much longer. If we will compare with the standard treatment with the that what it is called, that is a multi-drug tuberculosis, that maybe takes more time, and cure rate also less. So that rate of the cure or rate of the or what it is called, the treatment satisfactory rate also less. And a prolonged infectious with the transmission resistant pathogens and other community and public health impact. It may be spreading on the other community, and it may be increase the infections to the other so community or other type of the patients also. So these are the threat, these are the impact happened by the tuberculosis patients, multi-drug tuberculosis patients. If we will focus on the MRSA, that is the nosocomial methicillin resistant staphylococcus aureus. So here also we can observe that when we are talking about the methicillin sensitive staphylococcus aureus, that is hospital day will be 4 days, if patient will be stay 4 days, and the medications cost that may be 9,661 USD. But when we are compare with that resistant staphylococcus aureus, that maybe patients will be stay for the 12 days, and it may be cost will be increased like 27,083 USD. So we can easily understand that what are the impact are happened in the cost wise, even though directly and indirectly. Hospital cost and other cost also increases, and obviously the mortality rate also increases. If we'll focus to the another example, that is the cost implication changing to the malaria treatment. So here we can observe that some countries like African countries, so in that case the chloroquine or sulfadoxine pyrimethamine, this type of the agents are not work out. So for that reasons they have implement the one type of the combination therapy that is known as the SCT. Mainly that is happening in the African country. They are the chloroquine and sulfadoxypyrimethamine, they are not useful drug for the malaria treatment. So if you will talk about the SCT regimen, that is the atrimethrin and lumefantrine, this type of the agents when we are using, so the cost of the adult treatment that reaches to the 2.4, but where is the chloroquine and sulfadoxine pyrimethamine, that is the 0.13 and 0.14. So we can understand, or we can clear that mainly that will be affect the cost of the treatment. So not only cost of the treatment, even though that will be increase the mortality and morbidity, and scientists are working on different type of the what new generations of antibiotics, so that are the impacted of the different type of multi-drug resistance. So now we will slightly go to the basics of antibiotics and mechanisms of the antibiotics. So as we know that there are the different mechanisms of antibiotics are there. As we talk, that have the cell wall synthesis inhibitor, so that like penicillin and beta lactamase, glycopeptides. So several type of the drug are used which can helpful to cell wall synthesis inhibitions. So this type of the drug, they are targeted to the cell wall, and when the cell wall will format, so in that case that will destroy the cell wall formation. So the bacteria easily they can stop the growth of the bacteria. And sometimes the drug are act on the DNA gyrase inhibitor. So DNA gyrase is nothing but that is one type of the enzymes which can produce the positive supercoiling of the DNA. So that positive supercoiling of the DNA, when it is be produced by the DNA gyrase enzyme, some drugs we are using as a chloroquine and fluoroquinones, that type of the enzymes, sorry, that type of the antibiotic, they can stop the DNA gyrase formation, or they are inhibiting the DNA gyrase enzyme. So the coiling or replications of the DNA will not be takes place. Some drugs they are working on, they are act on the inhibitions of the DNA dependent RNA polymerase. So that is the transcription and translation, one of the we can say that protein synthesis. So in that protein synthesis, by they can inhibit by the RNA polymerase enzymes like rifampicin. And some drugs, they are working on the cell membrane synthesis disruptor like lipopeptides. So they can disrupt the cell membrane by the various mechanism, and the cell membranes are not produced, the bacterial cell will not form. Some that are act as a folate synthesis inhibitor, as we know that sulfonamide. So is a one of the important drug. So that will work as an anti-metabolic. PABA, we know that para-aminobenzoic acid, it's required to DNA synthesis. So when PABA will not be formed, dihydrofolic acid and tetrahydrofolic acid will not be produced. So that the protein synthesis will not be take place in the ribosome. So without protein synthesis, the bacteria or the organism may not be survive. Some drugs act as a RNA synthesis inhibitor. So that act on the inhibit the RNA synthesis. So if RNA will not be synthesized, so the protein will not be synthesized. Some directly that are inhibited the protein synthesis. They may be act on the different type of the ribosomal unit like 30S ribosomes and 50S ribosomes unit. So in that we can tetracycline, aminoglycoside and macrolides and several type of the antibiotics are there. They are act as a protein synthesis inhibitor by binding with the 30S ribosomes, by binding with the 50S ribosomes. So that is one of the brief introductions of the mechanism of antibiotic. There are the what are the different conditions and different type of the drug working on different types of the mechanism to inhibit the synthesis of newly microorganism. So by that we can inhibit the microorganism growth or the proliferations of the microorganism. So in the next we'll talk about the multi-drug resistance. In that multi-drug resistance, if we'll classify the multi-drug resistance, so there are the several type of the classes are there. So first one, that is the primary resistance, and second is secondary resistance, and third one is that clinical resistance. So primary resistance are also known as the natural resistance. So in that the microorganisms are getting the resistance without presence of the drug also. Without presence of the drug also, they are naturally they are resistant. They are getting the resistance in their cell. But when we are talking about the secondary resistance, there are two types, like intrinsic resistance or MDR and extensive resistance or XDR. And another one is that clinical resistance. As we said that the primary resistance that occur when the organisms has never come to across the drug. They are not across the drug. They may be not faced with the drug, but even though in the cell they are getting the resistance by the different biochemical mechanisms or genetical mechanisms also. When we are talking about the secondary resistance, that is known as the acquired resistance. So the cells are acquired this type of the resistance by the different mechanism. So it may be genetical mechanism or it may be that biochemical mechanism, but in presence of drug they are getting the mechanism, they are getting the resistance, and they modified their genetical change like chromosomal change like DNA structure, and for that reasons they are acquired this type of the resistance on the particular type of the drug. So if one single organisms got the resistance of several type of the drug, for example, that one organism they are get resistance penicillin, cephalosporin or chloramphenicol, such type of the drug, so that is known as the intrinsic resistance. Means that is the that is the intrinsic resistance or MDR. Suppose any organisms they are resist of the different type of the drug or different what it is called species of organism, that is also known as the extrinsic resistance, and that is also known as the XDR. And if we'll talk about the third classes, that is the clinical resistance, in which the infecting organism is inhibited by the concentration of the microbial agents. So it's mainly depend upon the dose. If we are selecting the dose, also the microorganism cannot damage or cannot destroy by this particular type of the dose. Because why? Because there are the several type of the reasons are there, that maybe drug are not reached particular amount to showing the therapeutic effect. So it's a produce the therapeutic failure and reappearance in the infections. Again, there may be chance to the infections. So it's related to the dose. It's related to the dose of the antibiotic. So it's known as the clinical resistance. That will therapy, obviously everywhere will get the therapeutic failure, but reason wise when we'll see that mainly dependent upon the dose of the drug or dose of the antibiotic, means concentrations of the antibiotic. Next, if we'll talk about the mechanism of antibiotic resistance. So if we'll talk about the mechanism of antibiotic resistance, so there are the two type of the resistance mechanism. One is the intrinsic or natural, another one is that acquired or genetic method. So in that acquired and genetic methods, they are also again classified two types. One is that mutations occur by the chromosomal, another one is that plasmid method or extra chromosomal method, we can say. So basically one is the genetically method, another one is that non-genetically or naturally methods. So in the when we will talk about the intrinsic resistance, here we can see that lack target. So maybe what is the target of the antibiotic or particular type of the antibiotic? For example, we'll talk about the penicillin. So their target is that is the cell wall. So by getting the resistance of the organisms, there may be absence of the cell wall. So the drug cannot come and they cannot find the particular target, and for that reasons they are not fight with that particular organism. So that is the intrinsic resistance, that is comes under the intrinsic resistance. Inert efflux pump. So inert efflux pump, when we'll talk about, so here what happened, the drug blocks from the entering cells and increase the export of the drug, does not achieve adequate internal concentration. What I said, like clinical resistance, in that case also we can take the same examples, like what will happen, the they are cannot enter into the cell, one of the reasons. Another one, if the drug enter into the cell, bacterial cell, by efflux or by export of the drug, it will comes outside of the bacterial cell or organism cell, so that the drug cannot show their particular type of the mechanism. Another one is that is the drug inactivation. Sometimes what happens, some enzymes they are producing, some metabolic product they are producing. So by that reasons what happened, the drug are inactivated. If we'll talk about the acquired resistance, in their main thing is that is the genetic modification, or we can say that is the change of the DNA structure. So when the DNA are there, so in that cases what happened, the DNA structures are changes by the mutations, by the for the they are changing their checkpoint of the organism checkpoint. Checkpoint means the what it is called, for survival of the organisms, they are modified their DNA structure, they are changing the nucleotide sequence. So by these mutations, so drug cannot identify the proper DNA, so they cannot bind the particular part of the protein or DNA or RNA. Occurs of the frequency 1 per 10 million cell, that may be occur if you see the 10 million of the cell, that may be occur in the 1 or 2 organism. But problem is that often mutant have that will be spread to the other community, and that will be spread to the other organisms also. So we can take the example like Mycobacterium tuberculosis and Mycobacterium lepra, that are follow this type of the mutation process. So in that, I said that mutation process, that chromosomal mutations we have discussed. Now we'll talk about the plasmid mutations. In that extra chromosomal genetic elements, it can replicate independently and frequently in the cytoplasm. If one cell, we'll talk about the one cell, suppose one organisms inside of their cell, they are also getting the mutations. So that plasmid which carry the gene resistance, that is called the R gene, resistant genes, in called R plasmid. So that from R plasmid, R gene can be readily transferred from one R plasmid to another R plasmid in or to the chromosomes. So in the same organism, they can transfer from one plasmid to another plasmid to chromosomes. So by that, the genetically modifications occur in the bacterial cell or organism cell. Much of the drug resistance encountered in clinical practice in the plasmid mediated. So here we can see that mainly the plasmid mediated mutations are we can observe in the maximum cases. If we'll talk about the chromosomal or plasmid mutant, so plasmid mutations are resistance are occur in the maximum cases. So what are the different mechanisms of the resistance to the gene transfer? If we'll talk about here, we can see the transfer R gene from one bacteria to another bacteria. If we'll talk about the, suppose that one bacteria is there, when that genetical material will be goes to the another bacteria, so that R gene material, when it will be entered from one bacteria to another bacteria, they maybe follow this type of the functions like conjugations, transductions, transformations. So by that conjugation, transduction, transformation, the R gene can transfer from one organism to another organism. When we are talking about the only one single bacteria on one single organisms, the transfer of R genes between the plasmid within the bacterium. In the single bacterium, they are changing from one to in the cytoplasm, from one plasmid to another plasmid, and maybe it will be entered into the chromosomal. So that maybe follow the two method, that is the transposons and intergerons. So transfer of R gene from one bacterium to another bacteria, already I said that is the conjugations, transductions and transformations. So in that conjugations, what happened, that is the main mechanism spread the resistance. So in the conjugative plasmid makes connecting tube between the two bacteria through which plasmid itself can passes. So if we'll talk about the two bacteria, easily that can passes to the another bacteria by the one type of the tubes. Okay, so that is known as the conjugations. When we'll talk about the transduction, that is a less common method. In that method, the plasmid DNA enclosed bacteriophage transfer from one bacterium in the same species seen in the Staphylococcus and Streptococcus. So here we need the bacteriophage. So mainly the bacteriophage, mainly the virus act and as a vector in this case. So the virus that will enter from one bacterium to another bacterium. So by using that bacteriophage, by using the virus, the organisms, one organism can transfer the resistant gene to the another organism. By that, the another 2, 4, 5 like this, that multiplications will be occur in the bacteria of the resistant genes. So the resistant genes will be spreaded throughout the bacteria. Next, another one is that transformation, that is the least clinical problem, that is not a big issue. Main issue is that conjugation, then transduction. Transformations also one of the method that free DNA picked from the environment. They are not, here we can see that picked from the another cells, here also that picked from the another cell. Okay, so but here that is picked from the environment. So it's not picked from the any type of the particular cell or particular bacteria. But here cell belong to closely related to the same strain. So in the environment, when they are picked any type of the resistant gene, so same types of the environment should be there. Otherwise they cannot what it is called spread or communicate the gene from one to another. So it is a least clinical problems, but main problem is that conjugation and transduction. By these two processes, they are utilizing the what it is called that is the communications of the gene from one side to another side. If mechanism resistant of gene transfer in transposons. So in that transposons are sequence of DNA that can be moved around different position within the genome in the single cell. So in the genomes, then the single cell only, they are spreading from one cell to another cell. From single cell in the cytoplasms. So they are, in previous only we have said that will be spread to one cell to another cell, but here only that will be spread in the inside of the cell, single cell. The donor plasmid contain the transposons and integrated acceptor plasmid and the replicate during the co-integrations. Both plasmid is separate, each contain the gene carrying to the transposon like staphylococcus and enterococcus. So obviously it will be spread to one plasmid to another. One is the donor plasmid, another one is that acceptor plasmid. Donor plasmid will give the R gene, that resistant gene, and acceptor plasmid will be accept that. So like this, that will be communicate throughout the cell. So it is also one of the method of the gene transfer in the single cell. Now we'll talk about the biochemical mechanism of antibiotic resistance. So we discuss, or we try to understand that what are the problems occur on the genetically mutant. Now biochemical mechanisms are also there. So in that, preventing the drug accumulations on the bacteria. So here I want to tell one story, like things like if we will think about first, one thief, he stolen some gold item and he came into the room. So police persons, they are running behind of that thief. So now in that room, what he can do? He can do the several type of the mechanism. So now thief is in the room and police persons are there. Okay. So what will happen? Why I'm saying this story or this type of the thing? Because it is easy to understandable. What are the main mechanism, biochemical mechanism? So now thief is there in this room. What possibility is there to save from the police? So one is that, suppose this room having this one door. Okay. So he can close the door very properly. He can close the door very properly. So police person cannot enter in the room. Same thing, prevention of drug accumulation in the bacterium. So he can prevent, by closing the door, he can prevent the entry of the police person. So same thing, this is a bacteria. So when they are closing the target site of the drug by coating, by different type of the enzymes, so what will happen? The antibiotic cannot identify the proper target. So the antibiotics cannot enter into the cell. So the accumulations of the drug on the bacteria will be prevented. Modification and protections of the target site. So same thing here. If it's not, if you close the door, if thief will close the door, is it not sufficient? Then what he can do? He can keep a one stone beside the door, big stone. So what protections? If closing also not work out, by the genetical modifications, the bacteria can produce the modifications of the entry or modifications of the target site, so that the antibiotic cannot enter into the bacterium. Another one, used to alternative pathway for the metabolic and growth requirement. So they can use, suppose in thief, for he can open another door or he can create another door so that the police person cannot identify the target site. So alternative pathway of the metabolic and growth requirement, the microorganism, they can produce the alternative pathway of the growth and requirement and metabolism. For they need the different pathway, so they can produce by the genetical modifications, they can produce the alternative pathway. Another one, producing an enzyme. Okay, if the police persons are there, they have one stick, but if what thief having the bullet or pistol, what he can do? He can fight with the police person. So same thing here also, the organisms, they are generating the some enzymes, they are producing the enzymes which can able to fight with the antibiotics. So that are the 4 mechanisms, like accumulations can be stopped, protections or modifications can be done, and alternative pathways they can change, and they can producing the some enzymes, so that enzymes can destroy the antibiotics. So we can see that the one diagram is there. In that diagram or in that picture, we can easily understand that is the what are the different mechanism decrease the uptake of the drug. So if we'll close the door, what will happen? The uptake of the drug will not be possible. Increase the drug metabolism. So as we know, the drug are metabolized by the different type of the enzymes. So by the genetical modification, some enzymes, if the organisms are prepared or they made, what will happen? When drug will becomes inside of the cell or inside of the what it is called bacterial cell, drug are degraded, they are metabolized. Alter the drug target. What I said like previously, alternative way they create the alternative way, they create the alternative pathway for the metabolism. So same thing, they can change the target also. Impaired the aproprotic pathway, that is the cell death, sudden cell death or the continuous cell death pathway, that also they can alter. Alter the cell checkpoint for survival of the organisms. Some checkpoint they are preparing, so that checkpoints also they can alter. Efflux the pump, organisms can remove the drug molecules from inside to outside. So that are the several mechanisms of the drug resistance. So by the diagram we can understand that, like decrease the permeability. So in that diagram we can see that antibiotic normally enter into the bacterial cell by the porins channel. So this type of the channels is known as the porine channels, which we can observe in the several type of the microorganism. But if porine channels in the bacterial cell wall do not allow the antibiotics to enter the cell, if they're closed, one of the reasons. If they change their structure, second reason. So several type of the modification they have done in their body, so that the antibiotics cannot enter inside of the cell, bacterial cell, and they cannot fight with the bacteria or organism, so that resistance will be get generated. Similarly, structurally modified the antibiotic target. So we can see that here what happened. So structurally they are modified the antibiotic target site. So we can, in this diagram we can observe that. So here some structures are there, in that antibiotic can easily bind with that structure, target site, particular target site, because you know that we have the same type of the what it is called structural similarity should be there to binding with the receptor or target site. So here when the structure are changed, now the drug molecule cannot occupied by the target site. So there is the no mechanism, there is the no actions can be done by the drug molecules, so that the antibiotic are not shown their particular effect, the bacteria is getting the resistance. So here is the several type of the examples are there, like ribosomal point mutations, tetracycline, macrolides, alter the DNA gyrase. This is the target site. For example, tetracycline and macrolides, we know that what are the target? Ribosomal DNA, 30S ribosome, 50S ribosomes. So they are changing the target size by the point mutations. Ribosomal, this is called the ribosomal point mutation. So in that ribosomal point mutations, the tetracycline and macrolides drug cannot fight or cannot bind with the particular target site. DNA gyrase is like fluoroquinones, that are the agents or that are the drug like ciprofloxacin, ofloxacin. Their target is the DNA gyrase. If DNA gyrase structures will be changed, so or altered, so drug molecules cannot fight with that organisms. Modified the penicillin binding protein, PBP. Okay, so PBP is the penicillin binding protein. So if PBP structure will be changed, so penicillin cannot react or they cannot bind with that particular target site. Same like rifampicin DNA dependent RNA polymerase. The target site is that in the Microbacterium tuberculosis, if the changes of the target size or alter the target site, rifampicin also cannot be entered. Next one is that antibiotics inactivations. So inactivations enzymes, already I said that by the different type of the enzymes, antibiotic can be inactivate. So that will be bind with the some enzymes. In this diagram we can see that antibiotic release the some enzymes. They are formed the some enzymes, they are released to the cell. After that, what happened? Now antibiotic activations, enzymes bind to the antibiotic molecules. This is the enzymes molecule, this is the antibiotic molecules, they are binding. Third slide, we can see that enzymes destroy the antibiotic to prevent the binding in target site. So the drug molecules, and it will be bind with the enzymes, the nature of the drug or degradation or destroy are happened outside on the cell also. So this is also one of the reasons, by producing some enzymes, the microorganisms can get the resistance, they are generate the resistance in their cells by destroying the antibiotics. Some examples are there. By producing the enzymes inactivity antibiotics like that is the beta lactam antibiotics, beta lactamase, gonorrhea, and okay, inactivation of chloramphenicals, that are the some enzymes, chloramphenicol acetyl transferase, that are the enzymes that will degrade the chloramphenicol. Aminoglycoside antibiotic, they can inactivate by the acetyl phospho or adenyl transferase. They are producing by the some gram positive and gram negative organism, so that we can observe that beta lactam antibiotic, chloramphenicol, aminoglycoside easily that can be damaged by the different type of the enzymes which is produced by the organisms. So that by this thing, by this mechanism, the organisms get the drug resistance. Now we'll talk about the what are the different factors are antibiotic resistance. Why different reasons are there for the antibiotic resistance. So if we'll talk about the factor of antibiotic resistance, so there may be drug related factor, there may be environmental factor, there may be patient related factor, there may be prescriber related factor. Not a single factors are play the role. There are the several type of the factors are there which can play the important role for the antibiotic resistance. So if we'll talk about the environmental factors, so huge populations and overcrowding, one of the reasons we have the lots of populations and overcrowding in some areas, we are getting the overcrowding. So easily the organisms can spread to one person to another person. Rapid spread by the better transport facility. So easily they can transport by the one or cell to one human beings to another human beings or animals. We are not using the pure sanitizations. One of the reason, increase the community acquired resistance continuously in hospital and everywhere. Community acquired resistance are getting. Ineffective infections in control programs are not also available. Widespread use of antibiotics in animal husbandry, agriculture, and medicated cleansing products. So lots of antibiotic we are using in the animal husbandry and agriculture sector also. We are using several type of the antibiotics to getting the what it is called large amount of the product or to kill the pest, different type of the organisms, and some medicated cleansing product also we are using. So several type of the reasons are there. So environmental factors play the important role. If we'll talk about the drug related, so over the counter drug imitations and doctor or the pharmacist what happen inappropriate use of available drug, and increase the polymicrobial uses, and overuse of antimicrobials, inadequate dosing, lack of current knowledge and training. So that are the several reasons which are prescriber related reasons are also there. Faulty antibiotic use. So some cases they are using the more number of antibiotics. My antimicrobials is the over prescribed instead of the one. Sometimes the doctor they are prescribing 2 or 3 type of the antibiotics, or available without prescriptions also we can get. So that are the one of the reasons, one of the factor. Over prescribed antibiotic, clinicians should be first determined whether the antimicrobial drug are necessary or not. Without necessary, without in our country in India, without testing of the any blood test or any type of the clinical test, the doctor are prescribing the antibiotics. Okay, some antibiotics doctor or pharmacist can prescribe, but some antibiotic without test or without proper clinical diagnostic we cannot prescribe, even though it is going on. So there are the several drawbacks are there to increasing the resistance of the antimicrobial. So now coming to the point, so still now we try to understand what are the different problems are there, what are the factors are there, how the organisms are getting the resistance. Now we'll focus how we overcome that thing. That is the main important thing, is that how we this will be going on in throughout the country, but even though how we can manage it, what are the policy we can implement to antibiotics, we will focus on that. So first choice antimicrobial, that is the non-restricted use. So this is called the first, used by the all prescriber without approval by the senior prescriber. So some drugs are there, we should be categorized that type of the thing. Okay, so some drugs, some antibiotics without prescriptions or without prescriber or normal without concerning of the senior physicians, also we can take this type of the agent that should be safe, effective and reasonable priced antimicrobial agent. Some restricted uses drugs should be there in the classes of the anti policies for more serious clinical condition under certain condition, or less safe and more expensive and newer antimicrobial agents. And condition could include the following, like specific infections known sensitive to the antimicrobial medicines after culture and sensitive testing, and counter signature from the senior physicians, which is approved by the DTC. So yeah, or we can say the drug and therapeutic committee. So what happened? So in restricted uses, so some drugs we have to categorize that without senior prescriptions, without sign of the senior authority, we should not give or we cannot sell this type of the agents to the patient. Another one is that reserved antimicrobial very restricted uses for life-threatening infections known as B, resistance to other antimicrobial, approval needed by the DTC or microbiologist, then only we will give this type of the agent. If we will categorize, that should be policy, that should be an antimicrobial policy, and policies are also there, but unfortunately we are not following this type of the policy, and so that the reasons of multi-drug resistance or what it is called antibacterial resistance are producing in our body. Remedies of antimicrobial resistance. So if we'll talk about the remedies and the people's, only drug prescriber by health professionals should be used. Drugs should be taken as a prescriber. Self-medication should be avoided. Fulfillment of the treatment course even though they feel better. Use leftover drug, not sharing should be done. And drug not be saved for the next round of illness. Frequently use of drug should not be prevented. That are the some principles or some what it is called guidelines we should follow. But sometimes what happen, we are when we are feeling good, we are stop the antibiotic. Okay, but no, we should be completed the course what the prescribed by the prescriber, and sometimes some antibiotics without clinical diagnosis we are taking the antibiotics, so that maybe produce the microbial resistance. Remedies for the AMR, like health worker, what are the play? They are improving the infections prevention and control. Those who are in the health worker sector, we should be improve the prevention and control of the different type of the diseases. We should think about the sanitizations. So by that, the antibiotic uses should be decreases. So obviously that will be decrease the microbial resistance also. And drug to be prescribed only when needed. If it is needed, then only antibiotic should be prescribed. Irrational prescriptions to be avoided, and correct drug and dose should be given with the respective disease. So we should be prescribed for the correct drug and correct dose also. We should be give to the patient, then only it will be helpful. Scientists and industry, they can also involved in this management of the antimicrobial resistance. They are encouraging development novel drug for the effective treatment options. So if they are resisted when the organisms, so we can scientists can develop some novel type of the drugs by which there is the less chance to that what it is called, that is the resistance, less chance to getting the resistance by the organism. Newer diagnostic techniques should be measures. What are the problems and what are the diagnostic, what are the different reasons are there, and clinical diagnostic and serological diagnostic techniques should be developed. Then only it can be overcome, or it can be not overcome, it can be managed. Remedies for AMR, that policy maker. So in that policy maker, those who are in the policy maker sector, they can, and awareness sector and advocate sector. So in some laws and regulations, they can implement for the using of antibiotic by the organization and awareness program, suitable use of the drug, emphasis and prevention control, increase the cooperation, information networking among the stakeholder, and implement the some laws and regulations for the prescribing drug, so that some regulatory authority also if involved in the particular area, so that the policy maker, they can manage, they can control the multi-drug resistance. So if we'll talk about the global strategy to the address the AMR, so here you can see that there are the different type of the strategies are there. If we will follow this type of the strategy, so maybe we can manage the multi-drug resistance easily. For example, education's professional public. So we should be education to the professionals like doctor, nurse, and even though pharmacist, clinical pharmacist, community pharmacist, and some advocacy, some rules, regulation also we can implement. Regulations and surveillance should be there after using that type of the antibiotic. What are the problems? And medicine quality also should be there. Infections control by the different type of the medical team. Infections control should be there. Different research already we discussed, some innovative ideas by novel what it is called, novel active ingredients we can develop for the microorganisms to destroy the microorganism. Improving the health system, if we'll increase our immunity, there may be less chance to using the antibiotics, so less chance to the AMR. Prevention of the disease, pharmacy therapeutic committee and drug therapeutic committee, so they are also play the important role, and rational use of the medicines. So several type of the strategies, by using this type of the strategies we can control the AMR. Now what is the role of community pharmacist? So they are having the strategy, they are having the some guidelines, but as a pharmacist, what our role, how we can prevent or combating, we can fight with the antibiotic, sorry, we can fight with the resistance of the antibiotic. So there are the different become more complex due to the continuous due to the continuous using this type of the antibiotics, or this is one of the challenge, because continuously the antibiotic using are increasing. So that for management of that resistance, it is one of the challenges. But even though we can, if we, as a pharmacist, if we'll take the some type of the steps, so we can save and our society. For example, antibiotic stewardship program, community pharmacist as a gateway practitioner, vaccinations, educations. So we'll see that, like antibiotic stewardship is an effort of measures that improvement how antibiotics are prescribed by the clinicians, used by the patients, improving antibiotic prescribing to use the critical effective treat infections, protect patients from the harm causes by the unnecessary antibiotic use, combat antibiotic resistance. So that are the stewardship. That is the one type of the program. By this program, we can minimize the use of antibiotic. We can guide the how to use the antibiotic, and how we are give the instruction to how, if we will not use this particular consequence that may be produce the multi-drug resistance. Antimicrobial stewardship is the combined coordinate programs that promotes the appropriate use of the antimicrobial, including antibiotics, improve the patient's outcome, reduce microbial resistance, and decrease the spread of infection causing multi-drug resistance organizations. So that the antibiotic stewardship program, that what are the main motto, what are the main functions they can do, what are the main achievement, like enhancing the infections of preventions of control, controlling the source of infections. We can, what are the source of infections, we can control that, and prescribing antibiotic when they are truly needed. If it is needed only, that can only prescribing appropriate antibiotics with adequate doses, proper doses we should be follow, using the shortest duration of antibiotic based on the evidence. We'll choose the shortest duration. We should not choose for the 7 days or 10 days or more than days. Shortest duration antibiotic we should choose, but evidence should be there. Reassessment treatment when culture results are available. If any blood culture, urine culture, or any other culture, tissue culture result, diagnostic results are available, then we can reassess assessment of the treatment, supporting of the surveillance of monitoring antibiotic consumption, educating the staff, support to the interdisciplinary approaches. So by that are the main motto, and they are the working on the, by this program, by this antibiotic stewardship program, we can follow this type of the thing. We can guide the community, we can guide the staffs, we can health community or other community also, so that the resistance we can manage by this type of the program. Another one is that community pharmacist is a gateway of practitioners. So any disease when it will be happened, any, as India we can observe, so directly we are the patients are coming to the community pharmacy or in medical shop or in hospital pharmacist, what type of the antibiotic we should take. So in that case, mainly the gateway practitioner, we are working as a gateway practitioner. So in that case, we should think and we should choose the appropriate type of the antibiotic. And if it is not necessary, we should not prescribe or we should not give the antibiotic to the patients, because sometimes what happen, if some viral infections, even though in case the peoples are giving the antibacterial to them, so I think there is the no use of in the viral infections if you give the antibacterial drugs, or some OTC medications also we should be stop them. So if we will be stop them, or if we will be without proper knowledge, if will not circulate that type of the antibiotic, that may be also helpful for the community. Another one is that vaccinations we can promote, pharmacists can critical promoting the current availability of vaccines, and vaccines can be decrease the use of antibiotic. So no doubt, if previously vaccines was not there, but nowadays lots of vaccines are there. So if we'll guide or if we'll educate the patients or community how to use the vaccine and when you have to use the vaccine, so that the use of antibiotic we can decreases. Pharmacist can monitor the patients and identify those needed to immunizations and various time point of places. And pharmacist can also now administer the vaccine in the different site and different community of the society. Another important point is that education. For us, all most important pharmacist role is preventing antibiotic resistance as a educator. So educator antibiotic resistant act as a gateway of practitioner. Already previously we discussed about that. So pharmacist may have proactive and regards of education public about the important infection control process such as general hygienes, hand hygienes, and immunizations and staying home when they are sick. So some common sense or common type of the things if we will be guide to the peoples or community, there if we'll educate, if we'll give the some suggestions to the patients or community, so that also it will be managed, it will be helpful somehow. Pharmacist can access both the print material and tips how communicate and patients will be microbial infection and appropriate use of the antibiotic and other relevant topic. We can conduct the seminars, we can conduct the what it is called some workshops, we can publish the some pamphlets, leaflets, some we can give the some tips, so that the when it will be we can educate the people's use of antibiotic, how to use, what are the resistance, what are the problem with the resistance, what are the genetical problem with the antibiotic resistance. We can educate. That is the one of the most important things also to manage the resistance of the antimicrobial. Even the pharmacist can collaborate with the units, create the synergistic or synergic effect, modified effect, increase the effect in actions. They can communicate, they can, pharmacist can collaborate with infections control community to reduce the spread of resistance of pathogens. And they can communicate, they can collaborate with the microbiologist or microbiology department to collection and management of information of the pathogens and resistance pattern, how they are managed and what type of the pathogens. So by the communications or collaborative efforts also we can manage the multi-drug resistance or antimicrobial resistance. With the hospital management to develop and implement the policy of antibiotic uses. So the hospital management teams are also there. With the discussion with them, we can control, we can manage the antibiotic resistance. With the different department for educations of student, physician, pharmacist, nurse, and patients, with the collaborative information or collaborative work, we can manage the antibiotic resistance. And even the pharmacist involved in the antimicrobial procurement and quality, the spurious drug or misbranded drug, we can stop and we can, what it is called, standard drug or appropriate combinations of the drug, we can circulate to the society, so that we can help the society from multi-drug resistance or thing. So coming to the summary of today's discussion is that is the antibiotics are most widely used and misuse agent. Obviously it is a most used drug, the most used agents, and sometimes we are misusing these agents also. They contribute to the huge and growing global problem and loss of efficacy due to resistance, inappropriate use, key driver of the MR. That is the main thing, because of the loss of due to resistance, that is the inappropriate use. Main point is that inappropriate use that are the getting the resistance. Community pharmacists play the important role. So and preserving the effectiveness existing antimicrobial and contain the development of the spreading AMR, antimicrobial resistance. That is the community pharmacist is the very important role. In key strategy, so in there, updating and managing the antimicrobial formulary, we can update we can manage the antimicrobial formulary, developing policies antimicrobial procurement and quality, developing and updating antimicrobial guidelines, developing policies to improve the compliance with the guidelines. Example, reserved antimicrobials, level of prescribing, automatic stop the order or antimicrobial order form, evaluating antimicrobial use based on pre-establishment criteria for appropriateness, applying remedies measures, providing the pre-service and in-service education on rational use of antibiotic and multi-drug resistance or antimicrobial resistance, communicate with the infectious control committee, the microbiology department, both regards in the assessment, use data obtaining from the monitoring the antimicrobial resistance, providing educations to the patient on the use and abuse of the antimicrobial and encouraging the awareness of the antibiotics, support the pharmacovigilance activity and antimicrobials. So that are the key points or key strategy today's seminars. And if we'll conclude the seminars or topics, the pharmacists have a responsible assist to aware of the antibiotic resistance. They have the knowledge and resource in their fingerprints and raise awareness in the act. There are multiple opportunity. There are the pharmacists to assist the campaign and the recognized pharmacist key member of the antibiotic stewardship team, health system in milestone of infectious disease. Community pharmacists have a critical role play a combating antibiotic resistance in frontline practitioner who can educate in the and vaccinate the patients. So thank you for, I think some questions are there in the chatting room.
Thank you, sir. Thank you so much.
Manoj sir, that is what is nosocomial infection. Yes, sir, I understood. Okay, sir. This is the infection which is spread from the hospital mainly. That is the spreading from the community, from one community to another community. So please, if anyone having any question, I'll try to clarify. Hello, madam.
Yes, sir. Participants, if you are having any doubt, you can ask or you can please write in the chat box. Yes, Saurabh sir will share the Malik sir's mail ID in WhatsApp group after the session. Participants, if you are having any doubts, you can ask. I think sir has explained all the things so nicely that our audience is not having any queries. So, Malik sir, thank you so much for enlightening our participants with such an important topic, that is antimicrobial resistance is really a very big problem which is prevailing in our community, in our society, and also adversely affecting the society. You precisely explained that how we can prevent, how we can control, what are the main causes behind the spread of antimicrobial resistance. Really very in a very remarkable note, and it's really required that we use antibiotics only prescribed by the certified registered practitioner. As we have used these antibiotics over the counter as a over the counter drugs, but we should promote the use of antibiotics only under the prescription. And simultaneously, you nicely elaborate the responsibilities and the role of community pharmacists in the field of education, research, and healthcare. That is also very nice, and we are grateful for sharing this. We are grateful for you with you for sharing this valuable information and conducting such a wonderful session. And on the behalf of SIRT Pharmacy and Sage Group, we would like to share with you a certificate on the screen as a token of appreciation, as you can see, for your tremendous effort and sharing the valuable knowledge with us. Thank you, sir. Thank you so much. Kindly accept this
Okay.
certificate.
Okay, once again, I want to thank Director Sir, SIRTP, and that Priyanka Madam, coordinator of this session. And of course, I want to thank you all the participants to listening me. So, Madam will share my email ID if anyone having any doubts regarding the antibiotics and this. I'll try to. I'm not master of the antibiotic, or I'm not known lots of things about the antimicrobial. What I have, because we are in the same community. I'll we are also community pharmacist. We are act as a educator. We are act as a clinical pharmacist also. So by the collaborations of with all, we'll try to do the something about that in the community to reducing the antimicrobial resistance. Thanks once and again to all, each and everyone.
I want to ask one thing. Is there any difference between antibiotic resistance and antimicrobial resistance?
Microbial and antibiotic.
Antibiotic resistance. Is there any difference between these?
Difference means, of course, there is the difference. Antimicrobial resistance means what? That is that may be virus, that may be bacteria, that may be any type of the organism resistance. And antibiotic resistance means here we will only talking about the bacterial resistance. That is the difference. Antimicrobial means here we can talk about all the organisms. It may be bacteria, it may be virus, it may be protozoa, it may be fungi. But when we are talking about the antibiotics, only that is the resistance of bacteria. I think I cleared your doubt, madam.
Yes, sir. Yes, sir. Of course. Thank you so much, sir, once again for sharing such a wonderful knowledge with us. And I hope we would like to listen you again and again in our upcoming events also.
Thank you, madam. Thank you very much.
Thank you so much. Have a good day, sir. Thank you, sir.
Shall I leave, madam?
Yes, sir, you may. You may. Thank you, sir.
Thank you once and again.
And participants, we are having our next session. Our next session will start sharply at 1:30 p.m. After 15-18 minutes. After 15 minutes, we will start our next session. So, it's a request to all the participants to please stay with us and have a break for 15 minutes. And after the 15 minutes, we will start our second session by Dr. Madhu Gupta Madam. She is from Diksar, New Delhi. Good afternoon, ma'am.
Good afternoon, Priyanka ma'am. Hello. Good afternoon to all.
Good afternoon, ma'am.
Good afternoon.
Welcome, ma'am.
Hello. Hello to all. Hello. My voice is clear, na? Am I audible, na?
Yes, ma'am. Yes.
So can I share my presentation to check the video, sound, and the presentation is visible or not?
Sure, ma'am. Sure, ma'am.
So I just share my screen. Yes.
Okay.
So screen is visible. Presentation is visible.
Yes, ma'am. Visible.
I just check a video link. It is working or not. So that's by that time we have no issue for
Yes.
just. You are share. Next window. कैसा इसमें होगा? I think एक टाइम पे एक ही विंडो शेयर कर सकते हैं क्या?
Yes, ma'am. At one time.
अच्छा ओके ओके मैं उस प्रेजेंटेशन वाला हटा देती हूँ. जस्ट दोबारा करती हूँ. इसमें तो डायरेक्ट गूगल वाले नहीं होगी. गूगल से तो नहीं हो रही है. जो मैं डायरेक्टली मेरे को करना है दैट इज नॉट विजिबल. मैं सारी विंडो ऑफ कर देती हूँ. जो डायरेक्टली गूगल से करनी है ना, we have to download the video, then we can display.
Yes, ma'am. If it is possible, then please you can download the video, or then you can share your screen and the video will be played.
Video is not downloadable. Okay, it can. Now it is voice is
Visible now.
it is visible and voice is clear. Is there voice? Any
Ma'am,
voice?
you have to raise the voice of your phone. If you are using from the phone, then please.
It is 100%. It is 100%.
आ रही है आवाज? मैम वॉइस नहीं आ रहा है.
Voice नहीं आ रहा है. Okay. So it is possible कि on my behalf, if I share the link, so host or co-host can display the video from my side, because I think you have an option.
Ma'am, we can try. We can try. You just mail. Just time me or WhatsApp me.
Okay. Mail ID. Priyanka. RATHOR@gmail.com. Ban Jan. Okay. Priyanka Rathor banjan@gmail.com है ना. मैं बस वीडियो का लिंक भेजती हूँ.
Okay. So let me try.